Hi, I'm Dr. B, psychiatric nurse practitioner with 20 years of clinical experience, and today I'm going to be talking about stigma in mental health. I want to first start by thanking all the celebrities and all of the movements that have been going on over the last 5 to 10 years to try to take that stigma away from mental health diagnoses, right? There are many celebrities who have come forward and said that they are struggling with such and such disorder. And that is super important, and I hope that that continues. But I hope that even as a culture, we can begin to normalize those things. I think we have some distorted thinking when it comes to mental health treatment and mental health diagnoses. And we have this kind of all or nothing, like either you're good and everything's okay, or you are mentally ill. And that is not fair to put everything in this mentally ill category, because I think with many mental health diagnoses, we can continue to function. We're not mentally ill. I struggled with an eating disorder in my 20s. I've struggled on and off with depression and anxiety. I've been on medication a couple times in my life, and we need to normalize those conversations. I am not mentally ill, and I hope that I am able to use some of my personal struggles to help people normalize that, to take away the stigma that that is bad or somehow not mentally strong. So my whole mission is to help people believe that they are mentally strong. Because I remember when in the beginning of my journey of meeting the criteria for one of these diagnoses, I felt like it was another negative about myself. So I really challenge you, if you meet the criteria for a diagnosis, and we're going to talk about the DSM for 4 and 5 criteria for diagnosis in another video, because they are just a cluster of symptoms. They're a cluster of symptoms that you are experiencing. They are not who you are. And I think we often, that's where we take that stigma. I am an anxious person, as if that can never change or that can never improve. And so I challenge you to don't take that and make it part of your negative self-talk, okay? You are mentally strong. You can be even mentally stronger from wherever you are right now. And that is our challenge. And we use choice mapping to do that. It is a solid cognitive approach. And I want everyone to know it, everyone to feel comfortable in it. We have a common language. We can use the words depression and anxiety and not feel like it's just another bad thing about ourselves. The other problem with the stigma is that, again, that all or nothing thinking, that you're either mentally ill or you're good. And we don't even have a pathway to teach mental strength, a pathway of, that foundation. And so choice mapping is that foundation. It can be used in a professional therapy session because it is a solid cognitive behavioral technique, but it can also be used just in life coaching and personal growth. And we can all begin to learn to identify and organize what's going on in our brain, choose to move forward, choose to be positive, and take away that stigma of continuing to talk about it, because we are all on a journey. We are all on a journey, hopefully, to be mentally strong. And I truly believe that you are mentally strong.